Welcome back to the Savvy Skeptic Psychedelic Forum. We've been away for a couple of months, or rather, I've been away finishing my PhD. So we're back and let's catch up on psychedelic research. Rakesh, last time we spoke about MDMA for PTSD. Let's shift gears a little bit and talk about major depressive disorder.
Sure, but before we get started, I want to offer you quite publicly my congratulations on a major achievement in getting your PhD. Well done, Katya.
Thank you so much.
And
Thank you for your support.
yeah, of course, we do this together, right? And that's why this conversation about psychedelics between you and I and our colleagues is so important because the savvy skeptic is evolving.
Mhm.
The evolution is such that, as you mentioned, the last broadcast we had, last recording we had on MDMA actually garnered a lot of interest. But I think what's next up is psilocybin. And let's talk about the Usona study, which was a phase 2 trial of using psilocybin 25 milligrams with psychological support as compared to niacin 100 milligrams as kind of an active comparator with psychological support. And it got published in JAMA Psychiatry. If I remember correctly, it was the lead article in the September 2023 issue, and a big deal. If you look at the list of co-authors, it's pretty much the who's who, not just of psychiatry, but who's who of psychiatric academic centers of excellence. So it has arrived, and it's time that we have a deep conversation about this rather impressive trial.
So that's a great point. And I'll tell you what struck me right off the bat about this particular study is how well controlled it was. Um, Pretty much everything was controlled. Why is this particularly important in research on psychedelics?
And those of us who are savvy skeptics should be particularly thrilled that it was so well controlled because, there are many amongst us who kind of worry about this might just be a glorified placebo response. And I wouldn't blame people for thinking that way. So the trial was designed very much with the FDA in mind, but also the scientific community in mind in terms of assuring them that the most that could be done in terms of blinding the data, or blinding the assignment to whether you got niacin or whether you got psilocybin. And you're completely right in making a note that at every level they went out of the way to make sure that those of us who carefully look at data can be reassured that the study results are worthy of believing. So I join you in my great fascination with the study in terms of how well it was blinded.
Yeah, and so in addition to using niacin, obviously, people know when they're hallucinating, but niacin has an effect on the body, so people feel something. They also use centralized raters, which is really important for an objective, uniform standard for rating both symptoms and adverse events. So it's not being rated at the study site, it's being rated by the same people who are blinded and who have the same standards. They also used a data system, as you mentioned, that generated individual bottle labels for participants on the day of their dosing, so that absolutely everyone in the study was blinded. It was very carefully done. Can you tell us about the findings?
I'll be happy to. So before we go to the findings, we should perhaps be reminded that major depression is on a major escalation in terms of both incidence and prevalence. Our current standards of treatment, which typically are SSRIs, SNRIs, have ended up not being that effective. And on top of that, patients really do have to take them on a daily basis. So before we really talk about these results, please appreciate these are patients with definitely well verified major depressive episode of some significant magnitude. The
Mhm.
average patient had a MADRS on the pretty high side in the high 20s. So what happened? Remember, there was one single dose, only one single dose was given. And the endpoint of the study was 6 weeks later, so 42 days later. And this is what was found, that the average patient who received psilocybin 25 milligrams, remember, with psychological support, both
Right,
placebo
right.
and psilocybin arm received it, had a astonishing 19-point decrease. We should perhaps put this in context, Katya. Uh, 6 is considered statistically significant in some ways, but 12, a reduction of 12 points would be considered clinically substantial improvement. We have a 19-point improvement. So the difference between psilocybin and niacin was actually 12.3 at week 6 and 12 at day 8. So not only are we seeing a significant magnitude of antidepressant effect in those who received psilocybin, we're seeing it quickly.
Mhm.
So the 3 points that I think we should one more time highlight. Number one dose. Number 2, it was quick, day 8. Number 3, which I think is very fascinating, even 6 weeks out, there was no loss of efficacy whatsoever in terms of depressive symptom reduction. These 3 findings, when you put it together, is perhaps the reason why JAMA Psychiatry and our community became so excited when we saw the results of this very well conducted study.
Yeah, no, thank you for pointing that out. And obviously, I'm not a psychiatrist, and you are. And in your own practice, is this something that you see, that magnitude of difference?
I don't. I
Yeah,
don't. It doesn't happen commonly. And these were the average patients who were
yeah,
getting this magnitude effect. Now, obviously, we must also be careful in not overinterpreting the
yeah.
data. There was no arm of a standard therapy such as an SSRI or
Right.
SNRI. But having said all of that, Katya, I do think the results from this study are intriguing enough that we are excitedly awaiting Usona's phase 3 studies with exactly this indication.
Yeah, that's great. So let's talk about some of the other results of the study. So symptom response was significantly better with psilocybin and psychological support than niacin and psychological support. The difference in remission was not statistically significant, so we'll note that. But the study also looked at the Sheehan Disability Scale and did find significantly greater improvement with psilocybin than with niacin. And there were some exploratory endpoints that are important. So global disease severity was significantly better with psilocybin, but also self-reported outcomes. Um, so self-reported depression and anxiety symptoms, and also quality of life. And all of these were improved significantly with psilocybin and psychological support compared to niacin and psychological support. So, Rakesh, what about the safety profile? What was that like?
Yeah, yeah, let's talk about the safety as well. But let's for a moment reflect back on what you just shared. Those are some pretty remarkable things you're talking about. One single dosing
Yeah.
with persistent effects at week 6 with no attrition noted between day 8 and day 42. And the attack on depression, so to speak, was very broad based. It wasn't just symptom reduction, but functionality improvement and also the wellness markers had improved. This is very intriguing. So let's talk about the side effects. There were more side effects in the psilocybin arm as compared to the niacin arm. But please note, the vast majority of these side effects dissipated within one day, and almost all of them dissipated in the first week. For example, headaches were common with psilocybin. 66% of patients on the psilocybin arm experienced headache compared to 24%, and nausea. Nausea is actually a really common side effect at this dose of psilocybin, 48% versus 6%, but these were not persistent. And of course, patients experienced visual perceptual difficulties, but that also wears off. And most of it within 24 hours. But the most important and salient finding we should discuss is suicidality.
Mhm.
No suicidal ideations or behaviors occurred. Now, certainly one patient scored higher on the measurement, the Columbia Suicide Scale, also known as the CSSRS Suicidality Scale, at the beginning of the study. But please note, even on this one, there were more people in the niacin arm who had that challenge than had on the psilocybin arm. So the notable absence of increased suicidality that was previously noted in other trials with major depression really is a salient positive finding worthy of note.
But let me put on the savvy skeptic hat for a minute and ask you, do you think that the relative lack of a signal for suicidality could have been related to the exclusion criteria in the study? Because it looked to me like they really excluded anyone with a history of suicidal ideation or behavior in the last 12 months. And if that's the case, how do you think that might have affected the severity of the depressive episodes in this study? Because suicidality and depression often go together. What's your perspective?
Yeah, they often go together. They often go together. Not always,
Right.
thank goodness, but they often do go together. And the presence of suicidality is a strong marker for very significantly worrisome depression. You're right. Suicidality was excluded. So, if you want to think about this particular trial, you may want to think of these participants as moderately ill to perhaps moderately severely ill,
Mhm.
perhaps not severely ill. And that's okay because the majority of human beings, I as a clinician see for the treatment of depression, do not have severe, they have moderately severe. So, perhaps in time, we will have formal studies that examine the effect of psilocybin in such groups of patients. I do think your skepticism is warranted and a little bit of worry is warranted. But having said that, the fact that the majority of people who experience depression do not have suicidality, and that was the very population studied in this particular trial, is exceedingly worthy of our attention.
Yeah, and I think that's an excellent point, and I'd like to also tie it to what you said in the beginning, the increase in
Yeah.
major depressive disorder. This really isn't a disease of some some other very, very sick people somewhere. It's really in the midst of society around us.
Yeah.
It's so many of us. So this is really a trial in ordinary depression. Not anything special, not treatment failure, not treatment resistance. That these are people who have moderate to severe depression, which is really many of us. So what do you think is the take-home message of this study for you?
Let me dovetail with the very good point you made earlier, which is this isn't a study of hyper specialized groups of patients. While that is really important, I think in some ways it is the most common patient that we should be addressing. And that's what this trial did. So the take home messages are there is something quite important about psilocybin that acts as not just an antidepressant but perhaps bigger than an antidepressant. It seems to literally change the person's ability to perceive the depressive symptoms and shift their mind frame, their biochemical mind frame, perhaps even with a single treatment of a pretty significant dose of psilocybin. So 25 milligrams is a definitely perceptual dose for the majority of people. But what's worthy of note is it was one time. And the take home message might be we have a very worthy intervention for those of our patients who don't want to be on medication continuously, who are not interested in putting up with the side effects that go hand in hand with very many medications that you take on a daily basis. Now, we should also readily admit to the shortcomings of this study, which I think the biggest one is that we don't have a true active comparator. So
Mhm.
we don't quite know how does this compare to an SSRI or an SNRI. You and I did cover that, didn't we, with another study from Robin Carhart Harris a couple of episodes ago.
Yeah.
But in this episode, it's so important to appreciate this study can be considered a, I mean, this can be only considered a grand slam. It is a perfectly complete result with very limited side effects. What we do want to see is a larger study, more
Mhm.
centers. This one only had 11 centers, academic, non academic, and different kinds of depression, different severities, different populations. And this study was also predominantly of one race.
Mhm.
Whites, I believe, were 89% of the study population. And our country is significantly more diverse. So I look forward to the phase 3 studies. My gut tells me, Katya, that the phase 3 studies will also show the same results. But let's wait and see what those studies show us.
So I can't wait for that as well. And, on the other side, of course, there's also great need in treatment-resistant depression. Um, and next time, you and I are going to talk about um, study of psilocybin and treatment-resistant depression, the other side of what we've just discussed. So I hope that our savvy skeptics stay tuned. Thank you.